So tailoring treatment is you really, I think the best thing to do is to really understand the subtypes and get the right diagnosis. As I said, it's not one disease, and sometimes some labs don't go into the details of the subtype, because now we're starting to understand that different subtypes probably need to be treated differently. CD30 is a great example. I mean, it took pathologists a while to realize that they should be reporting CD30 expression on T-cell lymphoma patients, because it makes a difference in treatment, even upfront treatment. So that's one approach, is to make sure that the diagnosis is correct. We're also starting to understand the mutational landscape of these diseases. And even though it's not clinically standard yet to do gene expression profiling and next generation sequencing on these studies, but we do recommend that in the relapse setting, so we can actually figure out which patients are going to respond to certain subtypes of tumors. So for example, tumors that are, or T-cell lymphomas that are arising from T follicular helper cells have a lot of epigenetic mutations. So they can be treated with epigenetic agents. And we have data to show that the response rates of things like romidepsin, belinostat are higher in patients with T follicular helper subtypes of lymphomas, angioimmunoblastic T-cell lymphomas. So certainly if you have those diagnoses, I would recommend the patient gets those kinds of treatments. Similarly, we are starting to see data with pralatrexate, for example, which was approved in 2009. The response rates were about 30% in PTCL NOS and anaplastic large cell lymphoma, but they were much lower in angioimmunoblastic T-cell lymphoma. So that wouldn't be my first choice in the relapse setting when we start to treat these patients. We're also seeing now the newer clinical trials are incorporating mutation analysis to try to figure out which patients or which subgroup responds better to certain agents. And so we'll have that data down the line to tailor treatments even better.